Hello and welcome to today's program. I am Ogechukwu Ukekwe. The Minister of Finance and Coordinating Minister of Economy, Wale Edu, has said going forward the federal government intends to deploy technology in the prevention and treatment of cancer across the country. He said this in Abuja at the Mid-Serve Oncology Summit 2.0, where stakeholders gathered to chart a course for Nigeria's efforts to tackling the spread of cancer. Eden said that the technology is now playing a key role, and not only in the financial sector, but also in the health sector, and the current efforts of the government is to deploy technology to see how the cure of cancer. Also speaking, the Managing Director of Nigerian Sovereign Investment Authority, Aminu Umar Sadiq, said that the authority has continued to invest hugely in the prevention and treatment of cancer in the country. The Mamala Fund, alongside prominent advocacy groups, including Connected Development and Youth Hub Africa, has issued a call to action to the Nigerian government, urging it to protect the Violence Against Persons Prohibition Act from proposed repeal. This legislation, enacted in 2015, provides essential safeguard against gender-based violence and support the safety, empowerment, and education of girls across Nigeria. The VAP Act represents a milestone in Nigeria's battle against GBV, criminalizing various forms of abuse, including domestic violence, rape, feminine genital mutilation, and child marriage. The Mamala Fund and its partners urged the Nigerian Senate to reject the repeal of the Act and focus on amending it to include clear, inclusive language that safeguards all individuals, particularly women and girls. We'll go on a short break, and when the program returns, we'll be looking at sickle cell complications and aftermath. Welcome back. Sickle cell disease affects millions globally, leading to a range of severe complications and long-term impacts. Individuals also face increased vulnerability to infection due to a sperm damage, which impairs the body's ability to fight off illness. Managing sickle cell disease often involves regular blood transfusion to alleviate symptoms and prevent complications. However, these transfusions can lead to iron overload, requiring careful monitoring. Support from healthcare providers, family, and community resources plays a crucial role in managing these challenges. Ongoing research and advancement in treatment are improving the quality of life for those affected. By advocating for sickle cell research and support, we can work towards a future where individuals with this condition can live healthier and more fulfilling lives. While joining me on the program to discuss further is Senior Registrar of Pediatric Department, LASUT, Dr. Laminat Amotrunru. Thank you for joining me on the program, Doctor. So what are the most common complications associated with sickle cell diseases?
Thank you for that question. Sickle cell disease can affect every part of the body, from the head to toe. So the common complications are pain is the most common complication seen in people with individuals with sickle cell disease. And the pain can affect every part of the body. Pain occurs as a result of obstruction, let's say occlusion of the blood vessels, particularly the tiny ones. And this leads to destruction in the tissues supplied by these blood vessels. And every part of the body can be affected, but particularly, most importantly, lung bones, the abdomen, the back, and the chest are mostly affected by pain. Additionally, anemia is another complication, common complication seen in individuals with sickle cell anemia. And this is so because there is rapid breakdown of the red blood cell of patients with sickle cell anemia. On a normal day, individuals without sickle cell, the red blood cells is removed, or let's say matured, becomes senescent and removed from the body after about 120 days. But in individuals with sickle cell, this process occurs every about 30 days. So there is constant breakdown of sickled red blood cells, and this leads to constant anemia. And this can be worsened when they are predisposed to some during infection or dehydration, can worsen this chronic hemolysis that they have. Another complication that is common in them is called sequestration crisis. And this, what happens is that there is rapid accumulation of red blood cells in the spleen. And this presents with rapid enlargement of the skin and severe anemia. And I said before that they are constantly hemolyzing. So, but in this situation, it is very rapid. So this can even lead to shock if care is not taken. Another common complication that could occur in them is infection. They are predisposed to infection, to having infection due to several reasons, which makes their immune status low compared to individuals without sickle cell disease. Then also, they could also have something, what we called acute chest syndrome. Acute chest syndrome is a common complication seen in individuals with sickle cell, and this is occur as a result of infarction in the lungs, or when we say that obstruction in the lungs, vessels in the lung, or sometimes it may be due also to infection. And individuals presenting with acute chest syndrome may have chest pain. They may also have difficulty with breathing. And this complication is a very devastating and life-threatening complication that, if not taken care of, can lead to death of the individuals. Sickle cell also can affect the brain. It can cause stroke. Stroke, particularly in the young. Sickle cell disease is the commonest cause of stroke in the young. So those are some of the common complications seen in sickle cell individual.
So for the pains you mentioned, so what are the best strategies in managing this pain?
All right, thank you for that question. Generally, when an individual with sickle cell disease presents with pain, what they should do first is to present to the hospital, tertiary hospital, or hospital where they can be taken care of by specialists, people that have so much knowledge in the care of individuals with sickle cell. So the first thing in the management of pain is analgesic, that is pain relief. And this is given to them optimally in order to reduce the pain. Then in addition to this, there are some other supportive treatments, such as hydration. Hydration is very important because the hydration could predispose them to pain. So that is why the individuals must be well hydrated. Then identification of the precipitants, because most of the time, something must have triggered the pain. It could be dehydration, it could be infection, it could be extremes of temperature. So it is important to identify the trigger of the pain, and that should be well taken care of. So I mentioned analgesic, hydration, identification of the trigger of the pain or precipitants of the pain, and treat it accordingly. If it is infection, of course, antibiotics will be given to care for the infection, and every other thing that can precipitate it should be identified and well taken care of.
So you said sickle cell, individuals with sickle cell are prone to infection. Can you explain to us why this is so?
All right. So individuals with sickle cell are prone to infection, like I said earlier on in my statement when I was mentioning the causes, common complication of sickle cell. And this is so because there's something we call splenic hypofunction. The spleen is part of the immune system. As part of the immune system, it plays a role in protection of the body by preventing invading organisms from pathogen from invading the body. So in sickle cell individual, there is hypofunction of this spleen. So this reduces their immunity, thereby predisposing them to infection. Another factor that has been identified as a cause of reduced immunity in them is something because they have defective opsonization, in the sense that, there are several mechanisms that protect individuals generally from being infected by invading organisms. And when these protectors are overwhelmed, then the body will come down with that infection. But generally, in individuals with sickle cell, these mechanisms are, are, are impaired. And one of them is there's something we call alternate pathway of complement activation. So this, what they do is that, like, they identify pathogen, and before the pathogen distort or disrupt the, let's say, the activity in the body, those pathway, like they get attached to the pathogen and kill the pathogen. But in individual with sickle cell, these processes is impaired in them, so they are unable to prevent them invading pathogen from infecting them. Another factors that has been identified as a cause of increased susceptibility to infection by sickle cell individual is the fact that they have elevated serum iron. Iron, as it is a, like, a fertile ground for bacteria proliferation and bacterial proliferation. So now, in individual with sickle cell, they have excess amounts of iron due to several factors, such as chronic hemolysis, the fact that their cells are being broken down often and often, make them have increased level of iron. Then chronic blood transfusion, a lot of them, due to different crises or complications that they could have, they are susceptible to frequent blood transfusion, and this can result into excess iron in the body, iron overload. And this excess iron overload is a fertile ground for multiplication, invasion, multiplication of bacterial organisms, and this make them susceptible to infection. Those are some of the reasons why they're susceptible to bacterial infection generally, not just bacteria infection, both parasites, viral, parasitic, viral, bacteria, all forms of infection can be found in individuals with sickle cell disease.
Okay. So how does sickle cell disease affect the different organs, that's the heart, the lungs, or the kidney?
Okay, so sickle cell disease can affect every part of the body, like I mentioned earlier, from the brain to every part of the body. So now I'll just mention some of those complications as it affects different parts of the body. And this can occur from, it's like age long, can affect any age. So starting from the brain, I mentioned earlier on that they could have stroke. So sickle cell disease is a common cause of stroke in the young. And this could present with seizure, so they could have recurrent seizure, they could have headache, they could present with coma, they could have paralysis of side of the body, like hemiparesis. Then sickle cell can affect the eye as well, in which, due to this complication that as it affects every part of the body, is actually due to the pathophysiology. The main pathogenesis in sickle cell disease is the fact that due to the abnormality or defective gene that results in abnormal red blood cell production, which is that sickle cell production, which is insoluble, and that because it is insoluble, it can cause distortion in the blood cells, in the blood vessels, as it is found in different parts of the body. So in the eye, there can be sludging of blood. So it can cause glaucoma, there can be refractive error, there can be blindness ultimately. it can result to blindness in the eye. Then in the ear, it can also cause impaired hearing, it can cause deafness in the ear. In the lungs, it can cause acute chest syndrome, like I said earlier. Then the recurrent bacterial infection can also occur in the lungs. Then in the kidney, there's so many complications of sickle cell disease in the kidney. The first and the commonest is called hypostenuria. And this means that the specific gravity of the urine is very reduced. And this makes them urinate so much. And that's why some of them they wake up at night to urinate. It's called nocturia. They have a neuresis. They have polyuria. They urinate a lot. Then it can also lead to hematuria, like bleeding. They passing out bloody urine. It's one of the features of kidney affectation in sickle cell individual. Then there's something that is called nephrotic syndrome, in which there is loss of protein. The protein that are meant to be conserved in the body and used by the body is being lost in the urine. So it's called nephrotic syndrome. So sickle cell disease can as well cause nephrotic syndrome in the kidney. Then ultimately, sickle cell disease can cause kidney failure. Ultimately, so the kidney can ultimately fail in individual with sickle cell. Then when it comes to the liver, so sickle cell can result into something that is called hepatopathic crisis, in which there is pain and swelling of the liver. The gallbladder too is not left out. The gallbladder, it can cause gallstone in the gallbladder. And generally, let's say in the bone, it can cause infection of the bone that is called osteomyelitis can occur. And this is common, it's a common complication seen in individuals with sickle cell. Still talking about the bone, there's something that we call avascular necrosis. This arises as a result of loss of blood supply to the head of the femur, the long bone of the thigh, that femur. And this can also affect the long bone of the arm too, that is called humerus. And this can be very painful, and it can impact impair the quality of life of individuals with sickle cell. I mentioned earlier vaso-occlusive crisis, which is pain in any part of the body, can as well occur in individuals with sickle cell. I think I'm going to stop at that.
Okay.
The complications.
Okay. So how does sickle cell complication vary by age and gender?
All right. The differences, okay. So generally, there is no difference in the inheritance of the disease by gender, because the disease is inherited as an autosomal recessive disease, in which both parents contribute to the abnormality as it occurs in the child. However, studies have shown that when talking about the presentation, how the disease now affects individuals, different gender, there have been researches that have been conducted, that has been done on this, and findings have been inconsistent, in the sense that while some researchers found that the disease is worsening most of the time, the complications, mortality, morbidity, everything is worsened in males. Some authors have found no difference in the disparity, in the occurrence of disease by gender. So I would say there are inconsistent findings. However, based on my knowledge and research, no study actually identified the fact that the disease is worse in female. Some identified says there's no difference in the two gender, while some reported worsening case of the disease in male. But like I said, generally, the inheritance, there's no gender difference in the inheritance of the disease. Then by age, the disease can occur. There's no really difference in the age, in the appearance of the disease by age. However, some diseases Some complications are known to occur in children, such as there's something we call hand and foot syndrome. Hand and foot syndrome is usually seen in children in infancy, maybe at 6 months, and by 2 years, most of the children would have developed hand and foot syndrome. And the frequency of this complication is so reduced or not really found in adults. Whereas symptoms, complications such as sequestration crisis as well is common among children. And this is not common in adults, as most adults would have undergone autosplenectomy. That spleen would have been lost by adulthood in most individuals with sickle cell disease. So that's the disparity that could occur by age. While some complications are found more in children, some are found in adults, and some span through the entire age from children from infancy to adulthood, such as in case of pain. Pain can be seen in anybody, from children to adults.
So what are the role of blood transfusion in managing sickle cell complications, and what are the risks?
Blood transfusion play a significant role in the management of sickle cell disease,
Okay.
and it is very important in the care of individuals with sickle cell. Blood transfusion could be simple transfusion or exchange blood transfusion. And this, in fact, can serve as it is one of the primary prevention of stroke in individuals with sickle cell. So it is very important. It plays a significant role, and it cannot be eliminated from the care of individuals with sickle cell. However, it is fraught, despite the fact that it is very important and cannot be eliminated from the care of individuals with sickle cell disease. There are some complications that have been associated with it. And I'll talk about the initial the complications that can be seen in anybody, regardless whether you have sickle cell disease or not. Anybody, blood transfusion generally has its complication, and complication could be as a result of infection transfer. It can be a medium of infection transfer, even though in most instances, due diligence is taken to ensure that blood that is infected is not given to any individual. Such, the kind of infection that can be transmitted in blood are viral infections, such as HIV, cytomegalovirus infection, hepatitis B virus infection. But this, in our labs, these are well taken care of, such that individuals with those infections, in fact, blood are not taken from them, and any blood that contains those infections are destroyed. However, in Nigeria is endemic for malaria, and as such, you may not be able to eliminate malaria infection from blood that is transfused. So, malaria can be transmitted in blood. Apart from risk of infection transmission, transfusion reaction itself is a complication that can arise from blood transfusion, and this can affect anybody. This is not specific only to individuals with sickle cell disease. For individuals with sickle cell disease, due to constant blood transfusion or recurrent blood transfusion, depending on severity of the individual, severity of the disease of the individual, they are prone to iron overload from this recurrent blood transfusion. And iron overload, like I said earlier, can predispose them to bacterial infection. They themselves have reduced immunity, such that the disease itself can predispose them to development of infection. Then chronic blood transfusion, which may result into iron overload, may also be a fertile ground for bacterial infection. However, all these are the benefit of blood transfusion actually outweighs any risk factors, any complication or risk that could arise from that blood transfusion. As such, it is an essential part of the care of individual with sickle cell disease.
Okay, so briefly, how can people with sickle cell disease improve their quality of life despite the complications?
All right, this is very important. Improved quality of life is essential in individual with sickle cell. And this I will start by saying that comprehensive health care, starting from identification of the disease early. In many parts of the world, there is something that is called newborn screening. So the disease is being identified soon after the baby is born, because in those climes where that newborn screening is done, all children, particularly those with high risk, are tested for the disease, and identification at that early life makes both the clinician, the individual, and the parents, collaborative care begins early enough, and this improves the outcome of the disease and improves the quality of life. Apart from the comprehensive care of the children, of the individuals should take responsibility of their health as well by not undergoing risk behaviors like alcohol, strenuous activities, reduction in cigarette, avoidance of cigarette smoking. Those should be avoided. Hydration is very important. So any individual with sickle cell disease should ensure is well hydrated by taking adequate fluid intake. Is very important in these individuals. Then I talked about those comprehensive care. So now let me elaborate on the comprehensive care of individuals with sickle cell disease, starting from vaccination, taking adequate vaccination to protect them from being infected by those organisms that they are susceptible to. Then also, apart from adequate vaccination, there is something we call penicillin prophylaxis. In children less than 5 years, this is very important. They are given penicillin. And all this is to improve the outcome of their disease. Apart from that, there is primary stroke prevention. Knowing fully well that stroke can impair the quality of life of individuals with sickle cell. So it is essential that this is prevented. And there are, as part of the primary prevention of stroke, there is something that is called, there is a scan, transcranial Doppler scan, that is done for children between 2 and 16 years to identify those that have the predisposition to develop stroke. And
Well,
this,
Senior
any
Registrar,
identification of
Pediatric
this
Department,
individual
LASUT,
can.
Dr. Lamina Amaturu. I'm sorry we have to cut you short here. Thank you for lending your thoughts on the program. And that's all we can take on this episode of 360 Health. Many thanks for watching. Bye for now.